Good evening and welcome to our training session. This evening we'll be looking at the neck and the décolleté area, and we'll be looking at a multi-layer approach to rejuvenating with Nanosoft and NCTF. This evening we're joined by our doctor expert, Valérie Philippon. Thank you very much for being here.
Thank you, Peter.
And we have the doctor with us this evening to show us the technique. Now, throughout the session, if you have any questions you would like to ask, please do send them in via the live chat, and we'll do our best to answer as many as we can. So without further ado, I would like to hand over to Dr. Valérie Philippon to get things started.
So, dear colleague, I am very delighted to be with you tonight for a new training about the treatment of neck and décolleté, delicate area that will be handled with Nanosoft and NCTF. So, we do know that after dark circle and CrossFit, the neck is the second ranking in terms of concern for women. In order to treat the neck and to prevent, I would say, the correction of the neck, we will use the right combo of NCTF, the polyrevitalization treatment made of HA plus 59 ingredients, and used the latest device, C-marked, launched by Filmed, an exclusivity of Filmed, the Nanosoft needle. To go more inside the Nanosoft needle, it is made with 3 needles of 0.6 millimeter each, that is close to 36 gauge. Is very easy to handle, but remember we will go through the training, the red blue line should be in front of you. Then, what is very interesting, the added value of the injection of NCTF with the Nanosoft is for to have a standardized injection depth, so to be perfectly secure and very much quicker, efficient. Then after, you will really minimize the pain of injection, so your patient will be much more comfortable, and it's very important in order to be compliant for it. Then, at least, but not the less, it will really reduce the risk of bruises, especially on this area where we do know we have lots of superficial vessels. Then, just to see the kind of result you can achieve after 1 month's treatments, one session, look also on the tear throat and the lower eyelid, this little very delicate area, the kind of result you can achieve just after 1 session. And now, let's go back for the training. So, first of all, you prepare your syringe with the NCTF, and something is very important that you can use either the syringe of 3 ml you do have in the boxes, or you can use a syringe of 1 ml. Personally, I like very much the syringe of 3 ml. So, let's start to withdraw 3 ml of NCTF. Based on that, you will adapt the Nanosoft with the lure lock, like this. Everything is prepared. I will leave the cage inside. Even if my patient has already been prepared, I like very much to work on a perfect disinfected and washed skin. Remember, the Nanosoft have 3 microneedles, so we will do a real multipuncture at epidermal level, targeting the dermo-epidermic junction, so we really do need to be perfectly well disinfected. Okay. You need your skin to be dry, And personally, I do not put any anesthesia before. So now let's start with 3 key messages in order to be perfectly well. First of all, as I tell you, the blue line in front of your eyes. Second point, very important, you have to stretch the skin and to have a 45, angle. Then you feel the nano needle, to stretch the skin and to start in. And then after, you put the pressure not on the syringe, but on the plunger. And look, you will obtain this papilla. I prefer always to start following the line. And once you've got really the papilla, it goes very quickly.
Excuse me, doctor. Sorry, could I just interrupt you for a quick second?
Yes?
We have a question that's been sent in. Thank you very much for sending that in. It's a question from Mexico.
Yeah.
The question is, what are the components inside the NCTF?
Thank you for the question. The component inside of the NCTF is 5 milligrams of free HA plus 59 ingredients separated in 6 classes of ingredients. First of all, the vitamin C, E, B. Then amino acids, very important, 26 amino acids. And the more important are all the essential amino acids like leucine, isoleucine, which build, the collagen and elastin. Then we do have minerals like calcium, magnesium. Then we do have nucleoacids. Then we do have specific antioxidants. The more important, the more efficient is the glutathione, mainly.
Fantastic. So there's quite a lot of ingredients in there.
Yeah.
Thank you very much for sending that question in. Please do keep sending more in, and we'll happily field those questions for you throughout the training session.
So I will take more time to explain you exactly the way to reach, the best way to reach the good way to inject with the NanoSoft. First of all, the blue line in front of you. Then 45 angle, and then the pressure on the plunger. There is a little tip and tricks, very important, is to have this kind, of soulever, lift up, your syringe. As far as you've got it, you feel when the nano needle penetrates the skin, and then, you feel the way to pluck it. That is the things to do. The things not to do is not to have really this blue line in front of you. Because if you are like this, you know that the needle will not get in the skin, even if you are a bit like oblique. Then you do not need to be 90 degrees, and you do not need to press on the syringe. So in fact, it's quite subtle, but very easy. I repeat it again, the blue line, 45 degrees, and then kind to lift up. And you see, the patient do not have any anesthesia cream, and she feels perfectly well.
Sorry, doctor, I have another question, if I may. Thank you again for sending this in. This comes from Morocco. And considering we're talking about the angles that you use when you inject, what is the overall injection plan that you follow?
The overall injection plan.
What is the injection plan, indeed?
The injection plan we can target with the NanoSoft is really the dermo-epidermic junction. That's why it makes this treatment specifically efficient, because in kind of technique of mesotherapy, and I was in the Congress of Mesotherapy in Brussels with my friends, it told me with the NanoSoft you reach exactly, the layers we need to target to be efficient enough. So we reach really the dermo-epidermic junction.
Thank you very much for that. And thank you for that question. Again, do keep sending them in and we will answer them as we go.
So you see on the décolleté, you can go very easily, very quickly. And as I mentioned before, the fact that we standardized both the level of injections and the the level of injections, first of all, you do not have any bruise, and you are just in the right plane to be efficient to deposit this small drop of NCTF that will disappear between 20 minutes or 2 hours. It depends.
So I'm back again, Doctor. Sorry to interrupt you. We have a question this time from Italy. Thank you for sending that in. Now this question is, why use the NanoSoft instead of the cannula?
Well, it's a very good question. Cannula will be not at the same layers as the NanoSoft. As we do know, cannula is subcutaneous, so it will be to target another layer of the skin. NanoSoft is really to target the more superficial epidermic junction. And we do know that here we will have really good efficiency in dermis density, dermis thickness, hydration, homogeneity, and it will be very efficient specifically for this area and the lower eyelid.
Fantastic. Thank you very much for that. Again, more questions in just a few moments.
So then after, I will take another vial for the other side. For neck and décolleté, when you have a big area to treat, you very often need 2 vials. It's very important to have some very close papilla. So first of all, I always target, as I told you, I follow the line, you know, with always the same scheme. Blue line in front of me, very close papilla. It's not worth it, you know, to go too deep. And it's also not a problem if you have some NCTF drop. You just have to do massage, and as you can see, it has been all absorbed. That's why it is so important to have a perfect disinfection before. And the more gentle you are, the closer you are, the better your patient will support it. Before we do have NanoSoft, we use the 32 gauge needle to reach these layers, but it takes much more time, and we do have lots risk of bruises. Here, as you can see, there is no bruises. It's go very rapidly, and the standardization, you know, is very important.
Sorry, Doctor, I will just like to interrupt you very quickly. We have a question that's come in from Belgium this time. So you probably know the doctor I'm speaking out. We have the question which is as follows. Why not combine NCTF with another product, like MHA, for example, when treating the neck area and the décolleté area?
Well, you can combine, but not in the same syringe. And we do know that you can also go through with the NanoSoft with the MHA10 and MHA18, but not in the same syringe. And
well, that's perfect. No, thank you very much. And thank you very much to sending those questions in. So that one was from Belgium. I now have another one coming all the way from Iraq. So good evening to you, and thank you for the question.
Hello, Iraq.
This one is, how many sessions do you require?
That's very important. Number of sessions, at least for the first protocol, if 3 sessions like this, spaced out of 3 weeks. I always see my patients 2 months after. And depending the grade of aging or the grade of quality of skin, I very often recommend to do one session every month or every 2 months. If you have a millennial or young patients, now with the NanoSoft, when I do a biorevitalization for the face, and as far as I see some sign of dehydration of the neck, I recommend a specific NanoSoft with NCTF for the neck to prevent. But for patients, when they are more, in the case of Sylvia, 50, it's like a treatment, so it will take much more times. And here I will really recommend to have multi-protocols very regularly in order to redensify.
Thank you very much for that. And thank you again for those 2 questions. We will have more questions in just a moment, so keep sending them in.
So you see, you can go everywhere. It's very important also to go in the detail. Ça va, Sylvia? Something also that can really help is to stretch the skin. Before, especially when you are on curves, you know, you can stretch the skin like this. And you see, you need to be very gentle with the needle. There is no need to exert pressure. The nano needle, you know, you can really, with one nano needle, do all the neck, the décolleté. There is no need to change the nano needle, which is made in silicone. And this technique is directly inspired from the vaccination techniques. And that's make all the beauty and the efficiency of this new approach to target, you know, the dermoepidermic junction.
Excuse me, doctor, I have another question. It's a similar one to the earlier one about how many sessions. This one is, again, from Iraq, so thank you for sending that in. It is, how many sessions do you need before you start to see the results?
It depends what kind of result you want to expect. If you want hydration, and if you want more glow on your neck, and to feel, at the first session you will have it. If you want more density, and really to find wrinkle, it will need at least 3 sessions. Now, on the dark circle, which is something very important, you really can enhance both the discoloration and to enhance density after just 1 session. The neck takes more time.
Thank you very much for that, and thank you for that question. I have another one. This one is from Bulgaria. And this question is, what is the advantage of NanoSoft versus normal 33G needles?
Very good question. Thank you, Bulgaria. With NanoSoft, as I presented to you, you have 3 nano needles just, you know, put on the top. And also beauty of this device is that as you standardized, you know, with 0.6 millimeter, you do not, if you have the good handle, you have no risk of bruise. It's much more efficient because you have 3 nanoneedle 36 gauge, you know, at the same time. So the multipuncture in terms of methatherapy techniques is really more efficient. And you deposit the NCTF at the right point. With the 33 gauge, which is already excellent, you will never have, with this rapidity, this standardization of level of layers of injection, and you will also have the risk of bruise, and it will be really less comfortable. Look, it tells me about less than 10 minutes to do all the neck and décolleté. If I have some more time, I can show you how to deal with all the peri-orbital area. And here it will use less quantity of NCTF, and it will be also very efficient. So,
Perfect. I actually have a follow-up question
Yeah.
before I head off. Again, this is from Bulgaria. Thank you. Do you have any clinical data proving the efficacy of NanoSoft and NCTF 135HA?
well, the study is ongoing. So as of today, we do have some pilot study, but the study should arrive next year. What we do have is the feedback of the prescribers, and what they tell FilmAid first, you have really much more efficient and rapid results of fine wrinkles in delicate area. So it is really designed, this combination of NCTF 135HA injected with the nanotechnology designed for the very thin skin, both on peri-orbital area, neck and décolletage.
So that's some quite positive feedback you've gotten there so far from people already using this.
Yes.
That's fantastic. I do have one more question. This one is from Poland. So thank you for sending that in. This is, can we use NCTF for hair regeneration?
For hair?
Hair regeneration.
You mean for alopecia?
Exactly.
Yes. Alopecia or hair redensification or hair aging? Yes, it works very well.
Fantastic.
But you will not use the NanoSoft, because NanoSoft will not penetrate, the crâne.
That was exactly the follow-up question.
No, you will use the 32 gauge needle or the gun. The gun, you know?
Okay, perfect. And I do have one more question.
Yeah.
This one is from Spain. So
Yes.
thank you for sending that question in. Can we use the art filler fine lines with the NanoSoft?
Thank you very much also for this question. The answer is definitely not. Because with NanoSoft, you will not be able to inject even the fine lines, which is very low reticulated and with very soft texture. It will never go through the NanoSoft. Honestly, you will never succeed. That's the first point. And the second point is, as you can see, the papilla, very superficial. If you inject in this area with fine lines, it will be long-lasting papilla, more than 6 months. Like here, look, it's already started to disappear. So please, never inject, you will not be able, but even though so superficially. With cannula, it's an excellent approach to treat the neck with fine lines, and after, you can use NanoSoft. That's a multi-layers approach.
Thank you very much. That's some fantastic tips right there. So please keep on sending those questions in, and I'll continue to ask them of Dr. Valérie Philippon. So thank you very much.
So now, just to show you how to treat, the CrossFit. Here, it's very important to stretch the skin because it will give you more power to get in, and you will deposit some very small papilla, very close from one together, always with the same techniques. Blue line in front of you, 45-degree, pressure on the plunger, and have this kind of level up. Something I always do to make it even more comfortable for my patients is, to give little massage. So I will give you my little tip and tricks. It's not the case of Sylvia, but when I do a toxin and my patient wants more, I want to be more efficient again, 3 weeks or 1 month after my toxin, I like, to redensify all this area with NanoSoft and NCTF, which is excellent. I like very much also to go on the upper eyelid like this in order to give a lifting effect, which is also very interesting for your patients that you do before or after blepharoplasty. Now, and to try to get rid of this little wrinkle, which are very delicate to have either with a 32 gauge without any bruise, because something which is very important on this area, which are very difficult to treat due to the bruise, here with NanoSoft Let Go, there is nothing, no risk at all. Very good. Something which is one of my famous treatment of that time, is for millennials. You know, they are always very concerned with their dark circle, which are not dark, but even if they are a bit, you know, lack of sleep and tired, it's very interesting to do 1 or 2 sessions of NanoSoft in this area. And I like very much sometime when I have a dark circle to do a bright pill before. It's very interesting. You can go very gently till the internal canthus, but here, please, even if it's very safe and standardized injection, please be always very soft. Yes?
I'm back again with another question.
Yes.
And this one is from France, so it's a nice local question. Thank you for sending it in. This question is, how many patients have been treated with NanoSoft and NCTF since its launch back in May 2019?
That's an excellent question, but I'm sorry, I can't give you any precise answers, so I prefer not to give it now. But what I suggest is to let you know, and for the next CIBLE training, I let my colleagues communicate this kind of data. What I can tell you, if I can give you a specific figures, that once you have it in your clinic, everybody wants it. And so I think it's going to go exponentially. The second thing I want to tell you, that even if you've got it, if you are not the right training, you will not succeed. So that's the point of my last blue line in front of you. Stretch the skin, feel that the nano needle get into, and then put a little pressure on the plunger.
Thank you very much. So we will get back to you with those key figures. And I have another question, again from France.
Yes.
What about NCTF and MHA 18? What are the benefits?
Well, the benefits of NCTF, we do know, is the reference in polyrevitalization in order to boost the fibroblast, which is aging. With all the components, both of HA, vitamins, antioxidant minerals, aminoacids. So we will rebuild some new dermis after 5 sessions, as it has been established in the instrumental survey, which is published. Now, MHA 18 is 18 milligrams of free HA plus glycerol. It will bring the skin more hydration. So it can be very interesting to have 18 milligrams of HA, for example, in the neck. You can do some big papilla, you know, in the middermis, for example, with a 30 gauge. And after, on beneath, put the NanoSoft with NCTF. I think it's all combination of treatments, one after the other, but one beneath the other.
Thank you very much for that answer, and thank you for that question. I would now like to move on to another question we have from Bulgaria. Can you combine NanoSoft NCTF 135HA with chemical peeling? And how can you, what are your thoughts on that sort of combination of protocol?
I thought it excellent. I love it. I love it, but only with very superficial peeling. And I think that the bright pill, may I remind her the composition of bright pill, which is made of gluconolactone with phytic acid, citric acid, little of glycolic, is ideal to treat the dark circle. And as it is very soft, dedicated for sensitive skin, it is totally possible and comfortable to do it before the NanoSoft, not after the NanoSoft. And I think it's an excellent combination of NCTF, NanoSoft, and bright pill.
Perfect. Thank you.
I recommend it really, especially for the dark circle.
That's perfect. Thank you very much for that, Doctor. And I would like to move on to one more question. This question comes all the way from Canada, so thank you for sending this one in. It says, how can we get our hands on Nanosoft? How can we get it?
How can you get it? By FilmEd. It's an exclusivity of FilmEd. As FilmEd, you know, now have since 40 years, the NCTF is one of the leaders, and he always try to do its best to get the NCTF bring to the skin. And Nanosoft is a genius of FilmEd to provide the doctor with this new device. And concerning Ivan Bartolome, which is one of my friends and president of the Society of Methatherapy in Brazil, told me Nanosoft is like, you know, the cannula has been for fields. Nanosoft is ideal for methatherapy. So to call FilmEd.
So just on that, because this question came from Canada, in North America, are there any FilmEd sales representatives over there or someone that they can get in touch with locally to get some of this product?
Well, I think Canada will be soon with FilmEd, but the best is to call FilmEd and to join by mail, and you will have the right contact. I don't know exactly the name of the people, but you can send a mail to FilmEd, who will answer you, sure.
So there you have it. Just send an email and FilmEd will get in touch with you so you can get your hands on this product. So thank you for that question. I would like to move on to another question now. We have one from Portugal. So thank you for sending this one in. And this question is, how long do the papules stay?
That's a very good question. So, look, that's very interesting. If we can make a zoom, please, on the neck and décolleté of my patients. As you can see, some papilla have already disappeared, less than 20 minutes. Some are still there. The ones that are still there are the bigger one. The little one have already disappeared. So that's a first, how would I say, key point to make the papilla long-lasting or more quickly visible. After, it is very individual of the people. Concerning the eye circle here, they can last from 20 to 2 hours. What I suggest you for your first patients, if it's noon and they have a meeting or she have a meeting in the afternoon, it's not to start with Nanosoft immediately, but better to put an appointment after 5 or 6 and to see how long it will remain. It is very personal because it can be for 20 minutes from 2 hours. What is important is not to do some too big papilla. Well, some things not to do is also to inject Nanosoft when you have bag here and edema. It sounds logical, it's good sense, but I prefer to give this little precaution of use.
Thank you very much for that, and that is very useful information. And thank you for that question from Portugal. I now have another one again from North America, from the United States. So thank you for sending this question in. And it's about the hair regeneration and redensification that we spoke about earlier. With hair regeneration and Nanosoft, how many sessions do you need to start seeing results?
So, first of all, I would like to precise 2 key points. First key point, Nanosoft is not appropriate to treat hair because as I finished, so I'm going to present it if we can focus on it. Nanosoft is very little needle of 0.6 millimeter. It will never penetrate, you know, the scalp. It is really too tiny, so it's not appropriate. Nanosoft is really dedicated to target delicate area where the skin is very thin. So, briefly, it's mainly all the peri-orbital area, lower eyelid, upper eyelid, crossfit, neck, décolleté, or when you have elastasis in very old women, you can try on the face. But please do reserve the Nanosoft where it is used to, neck, décolleté, and peri-orbital. Second point, we do not have, today we do have excellent result with NCTF, but using either roller or the 32 gauge needle. Yeah.
Thank you very much for that. And thank you for that question from the United States. I would now like to take us all the way over to Iraq, where we have another question.
Yeah.
And this is, if Nanosoft is not available in our country, how can we treat the area with a needle, and which gauge do you prefer?
Ah, good question. When we didn't have a Nanosoft before, we used a 32 gauge needle. So the 32 gauge, it is exactly the same level of injection, very superficial, but it takes much more time because you have to, for many reasons, much more time because you always have to be very concentrated, even if with Nanosoft you are concentrated, not to get a vessels. And also, it is a bit more, how would I say, painful. And as the standardization of the injection is not reproducible like with the Nanosoft, the result is less efficient. You really have more efficient results with Nanosoft due to the standardization level and to really get, to target where the fibroblast is superficially with NCTF.
And a follow-up question, again on the same topic. How much NCTF should we inject, and what does the NCTF actually contain?
So, how much quantity of NCTF should we inject? For example, on these patients, I inject 2 vials of NCTF, so it makes 6 ml. I think I injected 4 ml for the neck and the décolletage, and 1 ml per periorbital. So the quantity of NCTF depends on the indication, but I think for this kind of indication, when you do both neck, décolletage, and periorbital, you need at least 2 vials.
Thank you very much for that, and I hope that answers your question. Should you have any more questions, please do keep sending them in, and I will continue to ask them, but I'll now leave the doctor get back to her work.
So then after, I always like to finish my procedure with a message of B3 recovery cream from Skin Perfusion by Filmed, which is an excellent repair cream, very comfortable, enriched in vitamin B3 and HA, and which really provide more comfort to the patients. What also during this message, I take time to prepare her to see her face with this papilla and to reassure that the fact it will disappear at least between 20 and 2 hours. I really precise again in terms of precaution not to do any sauna or hammam. And something's very important, which is very dedicated to NCTF, that the sterilization is made by double filtration and not autoclave in order to preserve the efficiency of all the ingredients which are sensitive to temperature. That's also something very important.
Actually, it's good you mentioned temperature because we do have a question that's come in from Greece. Thank you very much. And it's actually whether the NCTF treatment can be done all year round, even in summertime.
Yes, that's something very important because with many treatments, peeling, lasers, you can't do it in summertime due to the sun damage and the risk of spot. With NCTF, you can do it all the year round. It is excellent even to do it before summer, before sun exposure, in order to prepare and to prevent the skin from sun damage. And after summer, after exposition to sun, to treat the skin with all the antioxidants. Because in fact, in NCTF, you also have as antioxidant the HA, 5 milligram, vitamin C, vitamin E, and glutathione. So that's why we really have this double benefit of prevention and correction.
That's fantastic. And just while you are answering that, so as you heard, you can use it all year round. We have another question from Dubai. Thank you for sending that one in. And it says, can we mix NCTF with Botox for a Botox-like effect?
Well, it's not in the labeling, so we personally, and we do not have any study about it. I know that some colleagues do it, call it mesobotox, but I do not have any data about it, sorry.
That's perfectly fine. Thank you for answering that question, and thank you for sending that question in. So without further ado, if you have any more questions, I will try and answer them, and I will leave Doctor back to her work.
Actually, I finished.
You finished?
Yes.
Well, in which case, ladies and gentlemen,
So I'm ready to answer all the questions.
in that case, as we have no more questions and we're almost at the end of our session anyway, I would like to thank you all for tuning in. I would like to thank you, Doctor, for being here, to showing us through this treatment all of the different techniques and tricks of the trade that you have. And thank you. Thank you for joining us for this evening's session. I would just like to remind you all that the next session will actually be on the 24th, it's a Tuesday, and that session will be held in French. So once again, thank you very much for being with us, and we'll see you next time.
Bye-bye. Thank you, joined us.